Was opened at the Charlotte Makeke Hospital in 2002. According to the Gauteng Health Department, it had over 100 beds and offered all specialized services at a reasonable price, with the province now having 4 units of this kind. Some members from the province's health committee say these units should be closed as they're running at a loss. Minister in this portfolio, Dr. Motsoaledi, joins me now to talk about the issue that we started, in actual fact, before the outbreak, when we had a chat to Professor Ken Huddle, Professor Benita Mayersfield. Minister, good morning. Welcome.
Good morning, and good morning to the listeners.
Very brief, Minister. A lot of people for the first time this morning will hear about the concept of Folateng and policy. What was the reasoning behind this idea in the first place?
Well, as I understand, as you say, they were established around about 2002. As I understand, it was to give a chance to those people who were on medical aid to utilize public hospital. There's a general view which is wrong, that when you've got a medical aid, you can only go to a private hospital. But medical aids are welcome everywhere, even in public hospital, and it doesn't have to be special in any way for you to go and utilize your medical aid there.
Minister, we had Professor Ken Huddle here, Professor Benita Mayersfield, and the picture that they painted was dire. They were talking about patients being turned away, preferential treatment. In actual fact, one of the quotes, we talked about economic apartheid within our hospitals. From your sense, is it as dire? I mean, look at some of the pictures on the screens right now, people sharing beds. We're talking about people being turned away. In your sense, as the head of this portfolio, do you get that same sense, or are we maybe over-dramatizing the situation?
No, I think we must not conflate issues here. Gauteng is growing very fast. That's a fact. It's growing extraordinarily. So hospitals like Chris Hani Baragwanath Hospital are burdened, extraordinarily overburdened. So what our plan is to build more hospitals. That's why Jabulani Zola Hospital has just opened to the public and is going to be formally opened very soon. Yes, and we need to put up more hospitals. What you are seeing there is obviously Chris Hani Baragwanath Hospital. What I want the viewers out there to understand, Chris Hani Baragwanath Hospital has gone far beyond the norms and standards of the World Organization. The World Organization has declared long ago that if a hospital has to be run normally and be managed, it must never have more than 1,200 beds. That is the limit. Bara has got 2,888. That is more than 2 times the norm. So they've already declared that once you go beyond that, the management of that, the overcrowding and all that is going to be a problem. That is what we are busy resolving. Part of the resolution is to build up more hospitals, especially around areas like Soweto, as I've already said. I'm sure very soon we'll be opening the new Natal Spring Hospital. I know I'm discussing with the MEC to really looking at Captain Park Hospital, which was once closed, if it can actually be renovated, start again, or, you know.
Minister, but at the heart of the problem, and I think this is something that we need to talk about, and I think you would have heard this too, that there are people being turned away because, I've heard it from Professor Ken Huddle, there are beds available, there are people that can use those beds, and yet they're turned away, in some of the worst cases, turned away to die. Have you heard of these kind of issues?
Yes, well, I had it 2 weeks ago, and already I can assure you, I asked the DG to write the DG of the HOD of Gauteng, that even though there's a process to do away, to face off the Folateng Units, it's not acceptable for anybody
to be turned away.
So that one,
and policy?
No, that one, I think it was just a management problem. It's not policy to turn anybody away.
No, but I mean, shouldn't there be a policy to say that it doesn't matter what circumstances, that people should never be turned away?
But that's government policy already. That's why I say it was a management problem, maybe ineptitude or just a mistake. It's nobody should be turned away from a public hospital. Where will they go? We have got private hospitals who turn people away. That ones they do,
for sure.
And they send them to public hospital.
But
we can't reject them, because where else will they go? Because Health is a right in the Constitution.
But as you're saying that there is a government policy that talks to those issues, even do these people know that whoever's managing it, that they're not allowed to turn people away when there are beds available in the
they're
Folateng unit?
supposed to know they are public servants who are senior, but we just reminded them with a letter that please don't do it. It's unacceptable, it's immoral, but it's so illegal because health is a right in the Constitution. Sure. You can't be turned away from a public hospital.
So we have it on record. You're not allowed to be turned away. If somebody's sitting at home, they've been turned away.
On the basis that you don't have, that a bed has been set aside for somebody who has got a medical aid. Because that's the reason that they are being turned away, that this bed is for somebody with a medical aid and you don't have a medical aid, so you can't utilize it. That's wrong. It can't be allowed. There's no way in which it can ever be justified. That's why we had to write a letter to remind, please don't do it, in case people didn't know. If they didn't know, well, that's a problem, but senior public servants are supposed to know.
But and I think just before we started this conversation, you're saying that the Folateng units are on their way out. You're not a fan of them? No,
I don't think it's correct. First of all, if you look at the whole concept of NHI, they will be working against that whole concept. The whole concept of NHI is to be able to deliver universal health coverage to everybody. It means when you say universal, you mean everybody. You don't.
Is covered.
Yes, you don't discriminate people on the basis of the depth of their pocket. You don't do that.
Final question to you, and thank you. Everybody knows that you're quite hands-on. Final question. When, what date, what time are we going to see these units gone with?
Well, I can't put a specific date because the Gauteng Health Department, I was speaking to the MEC just last night about them, and we have agreed. It's a process because there are also contractual agreements. They are working on them. There are people who are working there. They are discussing with them. So it's difficult for me to make a specific date. But I'm just saying, as a principle, we are definitely going to phase them off.
And they will not be part of the new national health?
Oh, no, absolutely not. Absolutely not. Can't be.
Minister, we're going to leave it there, but thank you very much for joining us. And of course, that's the Minister of Health, Dr. Motsoaledi, talking to us about a very contentious issue at the moment called the Folateng units and the policies related to it. Let's go over to